Hello, everyone, and welcome to this webinar. I start by saying that I'm very proud of our report, Stronger Minds, Stronger Media. It has been very well received by EFJ affiliates, the journalist organizations based in 44 countries in Europe, and I truly believe that together we have made great strides in raising awareness of the importance of journalists' psychological well-being. You know it in many newsrooms, it has really become a priority. Of course, not everything is perfect. There is still a lot to be done, especially in terms of individual awareness. Too often, we still encounter reflexive denial on the part of journalists themselves. But I really believe we are on the right track, particularly on the part of employers in the sector who have clearly understood the importance of this issue, uh, the importance of this issue for the sustainability of newsrooms. You should know that this report, co-produced by the self-investigation, was mentioned in the debates that led to the adoption in December of the European Economic and Social Committee's first report on the working conditions of journalists in Europe. And the good news is that this report was voted through a huge majority in the plenary session of the Economic and Social Committee, voted not only by representatives of trade unions and civil society, but also by employers' delegates. Among the 10 concrete recommendations in the report on journalists' working conditions, there are a series of requests concerning mental health, including a call for the European Commission to adopt a European directive on psychosocial risks at work. The fact that this report was adopted by a large majority sends a very important signal to the European Union, trade unions, civil society, and employers from all sectors agree that the mental well-being of journalists should be a priority. And they are together calling on European decision makers to take action. So we hope that this call will be heard. Thank you all for attending this webinar and enjoy it.
Thank you very much, Ricardo. I'll now pass on to Mar to tell us a little bit more about the self-investigation and also the context for in which the report was written. So I'll leave it to you, Mar.
Thank you, Rebecca and Ricardo. What great news and what great impact of this report already, which was published in late September, early October last year. And thank you so much for pushing this important topic into the EU agenda, which is at so many levels. So I think this is great impact and we should celebrate. I want to introduce myself, Mar Cabra. I'm joining you from Spain. I'm the executive director and co-founder of the Self-Investigation. Hopefully you know what the Self-Investigation is, but just in case, let me tell you that we are a non-for-profit based out of the Netherlands, but with a global spirit that promotes mental health and well-being in the media and beyond. Here's our information in this slide. And just know, as a way of context, because of course, we've only been in existence for almost 6 years, not like the many years the European Federation of Journalists has been. Just so you know, what we do is we support individuals and especially media companies, or media organizations, to promote mentally healthy workplaces. And we've already reached more than 12,500 media professionals and supported media organizations around the world and in Europe, like EULE, in Finland, and that is joining us here today. And we're very happy to see that many of the media companies that you're seeing on the screen are already prioritizing the mental health and well-being of their employees. The reason why this is so key is because the situation is dire. Mental health has become an urgent topic that we need to address in the media, and it's not a nice to have, but a must have. When we look at statistics from around the world, we see that anxiety, depression, burnout, and post-traumatic stress disorder are on the rise. And with high levels, regardless of country and media freedom environment. Of course, the situation is dire in places where media freedom is more at risk. But let's not forget, many of the EU countries are now facing media freedom threats. So taking care of the mental health of journalists and prioritizing that, it's a media freedom issue. And at the same time, not only, because when we think about mental health challenges of journalists, we tend to think about war correspondents and how they're affected by the trauma they see on the ground. And what we've seen in the research we've been doing in the past 5 years at the self-investigation, and what we've been seeing accompanying newsrooms, is that the newsroom itself can be, quote unquote, similar to a workplace, because we have toxic environments, because we have very intense demands that sometimes don't have people in mind, and people's health and mental health in mind. So we're really talking about a systemic change that we need to achieve here. We need to create healthier way of working, because the future of journalism, the future of democracy requires mentally healthy journalists. And that's what we do at the self-investigation, not only supporting people and organizations one-on-one, but also creating awareness and knowledge, like this report, Stronger Minds, Stronger Media, that we did with the EFJ. And let me just tell you why this report is so important. It was the first time anybody did a EU-wide picture about the topic. There have been reports on different countries, right? And we've seen there's reports on the US, there's reports on a few countries of Latin America, country-based reports like in Spain or in Italy, but what's happening to the EU? And I'm not gonna tell you much about that, because Emma Thomason is the author of the report and she's gonna be introducing some of the key findings. But really, my headline is mental health is a challenge for journalists everywhere, including in Europe. Let me just say, finally, as a few words, is that one of the ways we do at the self-investigation raise awareness about this topic is through the Mental Health in Journalism Summit, which is an event that we've been doing already for a couple of years. I'm going to just share on the screen so that you can see, and it gets on the record. This is the slide that we had to promote it in 2024, which was our first year. And let me give you a sneak peek and share some additional good news, which is we will do it this year again for the third year in a row. So feel free to actually go to this URL, mhjournalismsummit.org, to be the first to know what we're cooking, but it will happen at the beginning of October. So hope to see you there. This is the place to convene around these topics in the media and to learn from each other. So that's that. And then let me just do, one last message, which is we'd love to support you, your newsroom, you individually, if you think we can be of help. And here on the slide, you have our contact info and also a QR code where you can get in touch with us and we can start the conversation. Let me just tell you that I've been a journalist for 20 years and I quit my profession. I quit this beautiful profession because I burnt out. And now what I do for a living and what we do at the self-investigation is try to prevent key talented individuals, all of us, from resigning like I did. We want you all in this for the long term, and for that, we need to prioritize our mental health. Thank you very much. Looking forward to these findings from the report and the following conversation.
Great, thanks a lot, Mar. And I think that was a lot of information on the important work that the self-investigation does, and also your own personal story, which I think plugs in very well into the general findings of what the report has been, that your experience is not unique, unfortunately, in Europe. So I'll give the floor to Emma to kind of shed light on what were the findings on this kind of first ever EU-wide study. Thanks, Emma. You're on mute. There we go.
Can you hear me now?
Yeah.
Great. So hopefully you can hear me and see my slides. So yeah, my name's Emma Thomason. I'm joining from Berlin. I'm originally from the UK. I worked for many years as a foreign correspondent for Reuters, and I have been working as a consultant and a trainer, including with the self-investigation for the last few years since I left Reuters. And just let me move on to my slide. So yeah, this is a picture of me doing what I would have said back then was the best job in the world. Me on the left, that was in South Africa in the late 90s, covering Nelson Mandela. I really do think journalism is the best job in the world, but we have to make sure that we keep it that way. The picture of me on the right is in the Reuters newsroom in Berlin, where I worked for 10 years. And I have to say that towards the end of my career, I no longer thought it was the best job in the world. I also suffered a burnout about 10 years ago. And that's why I got involved in this topic of mental health and journalism, because like Mar, I want to make sure that what happened to me doesn't happen to other people. I think, yeah, we've gathered a lot of information in this report, and I'm so glad that there are people joining from outside of Europe as well, because, like we've said, I think these problems are common across the world. So this is just a little drawing that I did about why this is important. I think we've heard this already a bit from Mar and from Ricardo. You know, we're doing this because we care about journalists, but we also want our newsrooms and managers to be more resilient. And why? So that we can produce better news, so that we have a healthier business, but also for the sake of our democracy. So that's just my little introduction slide. This is an urgent issue. We know it is. We see it. We feel it in our newsrooms. And so in the report that I put together late last year, you will find key insights from across the sector. We've reviewed the studies that are already out there, but we've also done surveys of the EFJ and members. We're then going to hear about good practice, 3 cases today, but the report has more cases and some recommendations at the end. But before we do any of that, I'm going to ask to hear a little bit from you. So there's a Mentimeter survey. You can see the QR code on your screen, and I have to switch my screen now. So you will lose the QR code shortly and then get it back in another screen. So just 1 second. I'm gonna give you another screen. There we go. Can we see this? Okay. Can people see the code?
Yeah.
Okay, so there's the QR code, and there is the 75621453 that you can key in manually if you go to menti.com. And then we will see where what people are doing, who's joining us today, and then I will move on to some other questions. Okay. So we've got lots of others. It would be interesting to know what those others are, but I know, and I mean, we've got the names of the people who've joined. So there are quite a few people from civil society. This is helpful for us to know when we're talking about the results of the survey. Okay, I'm going to jump on to the next one. So what issues do you think are the most common triggers for mental health problems in journalism? "24/7 pressure is up there at the top. just going to wait for people to have a chance to answer the question. Poor management, number 2. Financial concerns, number 3. Okay. Online harassment, workplace conflict, are kind of coming in at 4th and 5th place. Okay, we get the figures. You will keep being able to contribute to that, but I think it's pretty clear that 24/7 pressure and poor management and financial concerns are the top 3, which is pretty similar to what we've seen from our surveys within the unions. So, what would help most to improve well-being? These are some of the things that companies are already doing. Okay, we all need more therapy. I think that is a general message. But also the importance of managers is clear here. So manager check-ins, training for managers. Okay, and the last one, I'm just putting the ball back in your court because I think one of the messages I want everybody to take away with them is that small things also help. Small things like supporting a colleague, just listening to somebody for 10 minutes. Also, obviously, bigger things like holding training, organizing an event, being a good role model. So taking holidays and breaks if you're in a position of power, speaking out about the issue. Well, that's what we're all doing today. I think that there's great power in that as well. Telling your own story. If like Myanmar, you've suffered in this area, and then talking about that, even in a small circle, it doesn't have to be on a webinar, but there can be great power in that. Okay, so I'm going to stop sharing that. Thank you very much for sharing your views, and the Menti poll will be open, so that's useful information that we're collecting as well. Just to go back to my other slides, just one second. Okay, so yeah, I'm going to give you a few key insights from the survey before I hand over to some of the other speakers. And the first thing to say is that we basically looked at all the surveys and polls that had been done already. As Mar said, individual countries, there's been quite a bit of research. Here are 2 key figures, which are 60% of freelancers in Europe say they've already suffered burnout. A German survey, 3 in 5 German journalists consider quitting the profession. In the report, we also highlight surveys from North Macedonia, Serbia, Finland. There is research out there, and the figures are pretty striking. You know, there's lots of worrying facts and figures that have already been collected, but probably still a need for some more pan-European research. So we also asked EFJ members that for their views on this topic from across the member countries, and most union representatives see the topic as very serious or even an existential issue for our profession. However, most of those representatives do not think the media industry is doing enough, and they don't think that the media organisations themselves see this as a priority, which is perhaps hardly surprising given the incredibly tough both news circumstances that our organisations are operating under, but also the sort of budget situation that many media organisations are facing at the moment. And like the poll that we just did, the main causes of suffering among journalists were seen as financial worries, 24/7 pressure, and then online harassment, workplace conflict, and poor management. There's the results from the survey. And the reason I think this is really important to stress is when I'm talking to people who are engaged in this issue and newsrooms themselves, so often we think that the problem is the news that we're covering, the non-stop negative, violent, distressing content that journalists have to cover. But time and time and again, when I talk to the journalists, when I talk to people in newsrooms, the thing that is really pushing people over the edge is the financial insecurity that they're currently in, or 24/7 pressure. And often that is connected with poor management because, just the pressure that newsrooms are putting on staff, which is obviously related to the financial pressure that the newsrooms face, cutting staff, fewer people having to manage more news. So the problems are really systemic rather than just the content that journalists have to cover. And I put this slide up here now. This is journalists are superheroes. This was used on a Women in Journalism Instagram post, and I sort of have mixed feelings about this because I think we are superheroes, but unfortunately, our kind of mindset that we need to work and treat ourselves like superheroes is kind of contributing to this problem of a workplace culture where we drive ourselves to burnout. I mean, obviously, the newsrooms are also partly responsible for that, but I think the types of people who are drawn to journalism, are also the types of people who with this vocation that we have to do an important job, are not great at setting boundaries, at saying, okay, my day is over, no more doom scrolling. And this is actually a quote from Mark Dozer from the University of Amsterdam, who's also written on this topic. And he says, what makes you happy also makes you sick. And I think this is, this is something to remember when we're talking about this topic, that our passion for the job, which is obviously very positive, can have its downsides. So with that, I'm gonna hand back to Rebecca, and we're gonna hear some cases of good practice from Germany, Portugal, and Finland. I'm not quite sure which order you want to go in, Rebecca, so hand back to you, and I will stop sharing.
Great, thanks a lot. I think this was a very important oversight into the issue, and perfectly on time. I was just about to interrupt there. I think we can get started with Sanna Heikkinen, YLE, which is the Finnish public broadcaster work capability manager. We think that's the translation into English. And I'll let her explain a little bit about what YLE is doing to better support journalists in the workplace and address the systemic issue that Emma explained. I'll just ask my colleague Georgia to share Sanna's presentation.
Thank you, Rebecca. Hi, my name is Sanna and I am from Finland. I worked for YLE for about 4 years now. My background is anything else but not in media, so this is a very new world for me, and I'm looking at maybe from a different perspective from that point of view as well. But in the first slide, there's just a few words about YLE, who we are and how wide we are in Finland. If you change the slide to the next one, just wanted to show you that we are all over Finland, and Finland is a big country. Like if you're talking about kilometers from south to north, it's about 1,000 kilometers. So we are very widespread, and that has a different impact on different issues as well as that fact that we have Finnish-speaking and Swedish-speaking regional offices. Of course, then we have correspondents and assistants all around the world. And like in many other companies in Finland, and I guess also in Europe, the mental health issue is the top one reason for the sick leaves of our people. So more than 30% of all sick leaves are, mental health based. And how big we are about 3,000 employees, which cover about 880 journalists. So it's a big number of journalists that we have also in the YLE. But then if we talk about the mental health or well-being in general, the next slide shows that in Finland we have a very strong legislation that requires us as employers to stop and think about these issues beforehand also. There's a link in the line Occupational Health and Safety Act, and that's the law that says what we need to do at the minimum at the workplaces. Here in Yle, we have this Occupational Health and Safety Committee that's mandatory by law, and we meet 4 times a year and to discuss these things. We also have a safety manager and 2 full-time safety representatives who are to help the whole organization. The law also says that we, as an employer, have to do these risk assessments regularly, and these are the kind of evaluations of how are we doing as a team. There's also risks like the physical risks or injury risks and so forth, but we also have the psychosocial risks that we have to evaluate team by team. And I think as a precautionary action, that's a very good way to stop and think about these things before something happens. The law also requires us to have this duty of care, so that we have to stop and think about things when we notice that something's wrong with an individual or with a team. So we have a very strong legislation behind this, and this probably helps also with the financial aspect, that we do have to do these things. It's not just that you can't say that we don't have the money, but we do have to do these things. The next slide, there's a little, we call this at YLE a little workability cottage or a cabin. And this is a tool for the managers or the teams to stop and think about, when we talk about work well-being or well-being in general, it's kind of like a very big round word, and it's sometimes hard to say, what is it really about? And this is a tool to help to slice it in a bit smaller pieces, to get the idea that if somebody in your team is having a problem, then as a manager, you can take this picture out and start the discussion, trying to slice it up in a smaller pieces. That is it in the self-management that you have problems with, or is the maybe in the competence area, or is it the workplace community, or is there something in the private life, that's bothering or affecting to your workability? So just, feel free to use this if you find it, a good tool to use. And then in the last slide, I made a list of things that we have at the moment, different means to prevent or help individuals as well as teams. On the left-hand side, there's some ideas what we do with the individual level. We have regular one-to-one discussions with the manager and team members. I don't know if this is 100% in use in the whole organization, but mostly I think so. As well as we have these developmental discussions twice a year, and these are mandatory. These have to be done. They are recorded in a system. And even in these, we talk about well-being and the competency issues. But as I think also within the teams, it's very important to stop and think about these things. It's not just on the individual level, but also as a team level. But maybe I'll finish with this and hand you over to Rebecca.
Thank you very much, Sanna. I think it's very interesting to see, when being mandated, obviously by law, what's possible, and to see some of the very easy tools you use to take care of the mental well-being of journalists. But in the case which I think most countries have, where there isn't the law to kind of provide that culture of protecting the well-being of workers, other organizations have to take the role, and this can fall upon unions or associations of journalists. So I'd like to invite Vânia Maia from the Portuguese Union of Journalists to explain the work they've been doing on this topic.
Thank you so much, Becca. Just gonna share my screen to make it easier for you to follow. So here we are. Hello, everyone. First of all, I would like to thank the FJ and Emma Thomason for inviting me to discuss such a relevant and often overlooked topic. My name is Vania Maia. I'm a freelance journalist based in Lisbon, and at the moment, I also serve on the board of the Portuguese Union of Journalists. We already suspected the situation was serious, but in 2023, the Portuguese Union of Journalists, together with several partners, carried out a survey that revealed a reality even more dramatic than we had imagined. Because of time constraints, the report is nearly 300 pages long. I will highlight just a few figures that really compelled us to act. Around 1/5 of Portuguese journalists responded to the survey, which makes it highly representative. So 57% of respondents believe their work negatively affects their health. 38% say they experience mental health problems linked to their profession. And it was quite shocking to learn that 48% of surveyed journalists report high levels of exhaustion consistent with burnout. The results were so striking that the journalist's health insurance provider decided to reinstate psychiatric consultations as part of its coverage. The survey also highlighted the main factors contributing to burnout. Lower income journalists report higher levels of exhaustion. Just to give you an idea, the average net monthly salary is about 1,225 euros, roughly 300 euros above the national minimum wage. And job insecurity, particularly the threat of unemployment, is also a major contributor to mental strain. Another finding, unfortunately not that very surprising, is that women report higher levels of fatigue than men. We know that women are still disproportionately burdened with unpaid work, and that clearly has an impact. Other contributing factors include conflict management, workplace bullying, including moral and sexual harassment, and occupational illness. All this shows how difficult it is to tackle this problem without structural change. This data will actually be updated very soon. We've partnered with a university and we'll be launching a new survey next month, focusing on journalists' mental working conditions and mental health. Once the Union of Journalists confirmed how serious the situation was, it launched several initiatives to try to address the problem. Just to give you an overview, we organized workshops to help journalists develop new skills, and we ran a 3-session awareness program focused on burnout. We also held a large conference on this topic where the self-investigation was present. But probably the most original initiative and the one with the strongest public impact was a 6-episode podcast on burnout in journalism broadcast on Portugal's national public radio. It's fair to say that these initiatives were only possible because they were part of the project Building Resilient Journalists, Burnout and Better Working Conditions, developed in partnership with the FJ. But this is in the past, and now we are focused in the future. Last year, I had the privilege of taking part in a very enlightening workshop on the invisible crisis of mental health, of mental well-being in journalism, organized as part of the Stand Up for Journalism initiative. Actually, that was where I met Emma. Thanks to the insights from that experience and to the connections it made possible, our union was able to secure funding to visit newsrooms and deliver sessions on mental well-being. We will try to involve managers, and we are preparing a dedicated session specifically for freelancers. These sessions will also help us understand whether there is enough interest to build a grassroots peer support system inspired by the helpline that you will hear about next. And thanks to the funding we secured, we will also be able to offer low-cost consultations with licensed mental health providers to our members. The number of consultations will be limited until the budget runs out, but we will continue working to establish new partnerships as we move forward. So this is how we are planning to address many of the recommendations included in the report that brings us here today. And before I finish, I just want to highlight how valuable it is to have a report like Stronger Minds, Stronger Media, which not only lays out the problem so clearly, but also points to solutions, some of them already in place in different countries, that can inspire all of us to help change the culture and environment of journalism. In Portugal, it has definitely inspired us. And as I told Emma, I think we all need to contribute to structural change without blaming individuals and challenging the idea that journalists are supposed to be superheroes, always available, always ready, no matter the cost. I think our passion should never come at the expense of our well-being, and we need to foster a sustainable, healthy relationship with our work, because healthy journalists are essentials for healthy journalism, and above all, for a healthy democracy. So thank you very much.
Thank you very much for this very quick, very important capture of all the work, very important work you've been doing. And now, as we've been hearing what can happen at the government level, organizational level, and union or association level, I'd like to pass the floor to Malte to talk a little bit more about this individual level initiatives and about the peer support program that Maya just mentioned. So over to you, to Malte.
Yeah, thanks for having me. I'll guide you through the brief history of our mental health project called Helpline. In 2021, the Dart Center for Journalism and Trauma in Europe approached Netzwerk Recherche, that's where I work, to set up some kind of support structure for journalists with mental health problems. And after roughly 2 years of planning and fundraising, we kicked off the Helpline in November 2023. And the helpline is a telephone service for every journalist who feels stressed out, fears to lose his or her job, or who suffers from any kind of mental health problem. And since Netzwerk Recherche is the German Association of Investigative Journalists, the helpline is independent from any media company, and our service can be used free of charge and anonymously. It's mainly for German-speaking journalists, but we also offer counseling in English. And the important thing is, instead of having professional psychologists answering the calls, we decided to go with the concept of peer support. So the people working at the helpline are journalists themselves, and they know the problems our callers are facing from their own experience, or at least they can relate to them because they know the problems in our industry. And we trained roughly a dozen peer supporters in techniques like psychological first aid and active listening to prepare them for this demanding job. In order to become known industry-wide, we went to every journalism conference you can imagine. We sent out flyers and stickers to hundreds of newsrooms in Germany, and the helpline was featured in multiple articles, podcasts, and TV shows. And today, 2 years into the project, we still face two major challenges. One is, of course, funding. In the beginning, we hoped to be able to fund the helpline by financial support from the industry itself. We convinced a few newsrooms to give us money, but that was not enough. We were lucky to get funding from the German government at a very early stage, and that secures our operations until the end of this year, but it's unclear yet how we can continue in 2027. And the second challenge is scale. Since we started in 2023, we receive one call per week on average. Knowing that the prevalence of mental health problems in German journalism is high, we believe that there is much more potential. So we ask ourselves, what can we do to reach these people, these colleagues? And now we are about to start our service on Signal, so that we are more accessible for people who are hesitant to call us on the phone, especially younger journalists. And we also started to offer workshops. Also, as part of this government funding, we were able to offer 15 mental health workshops for newsrooms. But the demand was much bigger, and so we decided to continue with that. And also because we can reach much more people with one single workshop than with our telephone hotline alone. And to wrap things up, the helpline offers direct help for those in need via telephone or messenger. We offer training, and we are raising awareness for the topic. And since we are convinced that we can only improve the current situation in journalism if the people at the top are aware of the problem, and are buying into a healthier work environment. We addressed newsroom managers in a series of roundtables last year. We spoke with 90 leaders on what is missing and needed in terms of mental health and journalism, and what prevention interventions work best in their newsrooms. And as a result of these 7 roundtables, we are about to publish a practical handbook on low threshold interventions for newsrooms to tackle mental health challenges. And hopefully it will also be translated into English so that we can forward it to all of you. And with that, I hand over to Emma, who's going to talk about recommendations as well. And this seems to be a good transition. In case you want to learn more about the helpline, I'll put my contact info in the chat. Thanks.
Thanks a lot, Malte. And without further ado, I'll hand over to Emma to discuss the last part of the report on the recommendations.
Thanks very much, everybody. Yeah, so you've heard lots of really practical things that have been happening. I guess one big word to put there is prevention. I think that's really striking from what we heard from Finland, the idea of early intervention, and kind of not trying to fix the problem when it's already happened, but trying to prevent it in the first place. Just to go back to the survey, and thank you very much. The details of the methodology and how many people were involved were shared in the chat. So from the survey, the priorities that we heard from the trade union community: number 1, better pay and working conditions. Number 2, training. We've obviously been talking and hearing about workshops in different countries. Number 3, awareness raising and advocacy. And I think it's really striking with the helpline in Germany that a big part of the work there has been around advocacy. Likewise in Portugal with the podcasts, and then the offering of actual therapy and coaching and peer support. Those were all highlighted in the survey that we did among EFJ members. But just to come to my kind of some of my top takeaways from this process. We've spent a lot of time today. In fact, the topic of this webinar is around mental health, what we can do to improve well-being in our sector. But one thing that I think kept coming up was the importance of being careful about our language if we want to overcome stigma. So, I mean, just from Portugal, Vanya didn't have time to go into that, but the workshops that they held in Portugal were not necessarily labeled as mental health workshops. They were workshops on various topics of interest to journalists, but there was some mental health support and content kind of almost snuck into that format. I think likewise with the helpline, the whole question of what do you call this service that you're offering to people? When we set up peer support at Reuters, we talked about for a long time, should we even use the word support? Should we use the word help? Because if people feel like they have to ask for help, it goes against this whole idea of the superhero journalist who never asks for help. So I think this is really important to think about what language we're using when we are offering workshops, when we are offering peer support type formats to journalists, because even saying I need help is a massive barrier for some people. And actually, I'm delighted that there are lots of men today on the call, because I think this is one issue that is a real topic also for men in terms of asking for help. I think, in this community of people who are involved in these issues around mental health and journalism, women are disproportionately represented and probably find it easier to ask for help. So that's one point I feel really strongly about. Don't use psychosocial, because who knows what it means anyway. I know we have to use it in a kind of formal EU setting, but yeah, think about your language. Several people have talked about this. This is really a systemic problem we're addressing. No amount of mindfulness or yoga classes are going to fix this. We need to change our working culture, the way journalists are compensated, but also, how we treat each other in the newsrooms. We've talked a lot about superhuman journalists. We are fantastic human beings in this profession, but we shouldn't have to act like superhumans. Also, keeping it simple and affordable. You know, there are small things that people can do without having to have the whole budget of the German government behind a helpline. Things can be done on a small, informal level that can be make greater impacts. Even as we heard from Finland, just a manager checking in on a regular basis. It's not just about mental health, but having some kind of system behind regular check-ins with managers can really change the culture in a newsroom. Yeah, managers. My final point, I think, it has to come from the top. Managers also have to buy into this, but they also have to be prepared to kind of be honest and open about their own challenges. And I think that was something that we found at Reuters when we were working on trying to change the culture, was getting senior people also to talk about their own struggles and how that can then make it possible for other people to ask for help and to open up. So those are some of my top recommendations. And yeah, just to say, 60% of managers say they're expected to provide emotional well-being without the tools to do so. So obviously managers also need training and support themselves. And I think we're going to hand back for questions now. So handing back over to you, Rebecca.
Yeah, thank you very much, Emma, and to all of the speakers. I think what really stood out from all of these interventions was the idea of cross-border collaboration or collaborating with other organizations in the same space, either within the same country or even in different countries. And I think this idea of support and that journalists are not alone and managers are not alone, and it's really a systemic issue that needs to be dealt with. And I liked Emma's quote of, you don't need yoga classes, you need change in workplace culture. Thanks once again to all the speakers. I would now like to open the floor to the participants, the audience. You've been great to stay with us this entire time. I hope you found it as useful as we did. And we'll let it over to Nevena to ask your question.
Hi, everybody. I hope you can hear me. Can you? Okay, I just have basically a couple of comments and maybe a question. What I would like, I'll try to be as brief as possible. I'd like to see, because this topic is now emerging, so to speak. We've seen it in the past several years, really emerging, and first serious research being done on the importance of the topic. There are quite a few differences between even regions in Europe. So, for example, I'm from Serbia. I'm from Independent Journalists Association in Serbia, in Belgrade. We are part of the Western Balkans, and for example, Serbia has been in the streets protesting for a year and a half now. So we are living in a completely extraordinary circumstances with extreme police pressure and state apparatus pressure on journalists. We have completely captured media, almost completely, very few independent media fighting for survival through small grants, and so on. Not to overburden you, of course, workplace culture goes without saying, and I would like to see a sort of a more robust methodologically more robust research. I'm just kind of calling for it. Let's see how we can do it all in the near future. Methodologically more robust, but also kind of with a particular attention to contextual specificities of certain countries or parts of the world, or Europe. We are talking about Europe now. One other angle I would like to,
Vanna, sorry, just to interrupt a little bit. It's just that we've got 10 minutes for questions. So if you have a question, if we can get to that, just to give time to others who would like to also take the floor. But we'll leave also our contact details in the chat so we can explore this quite a bit more, because it's of course very interesting.
Okay. Maybe if I can just give a suggestion, which is We basically need grants and money to provide people with professional support. Peer-to-peer is the first tier, maybe just first line of support, but people need more robust support and continuous. It doesn't happen overnight. It takes time and it takes money. So let's work towards that, towards changing donors' mentality and alerting them to this issue.
Yeah, for sure. Thank you very much. I wonder if any of the speakers want to react to that.
Hi, Nevena. Yeah, I totally agree with what you say. I think this report was really meant to be an overview. It wasn't an academic study. It was a kind of, taking a snapshot of academic research that's already been done out there. And clearly it would be good to have some Europe-wide data that has a proper, methodology that also comes up with good comparisons between areas. I would just like to say, though, and Serbia, what you're saying about the situation that journalists are under in your country is quite, striking, and all strength to you to how you're getting through it. But I think I will say, though, that it keeps coming up in I've worked with journalists in exile who've fled their home countries. Many of these issues are common across our profession, even in countries, like mine, like Germany, where I'm based, where we're safe, physically safe and not under so much pressure. But I think it really strikes me how much commonality there is across countries. So, but we need the data. I totally agree.
Thanks.
And to add to that, I totally support everything Emma has been saying. I would say that, Nevena, I think EFJ and the self-investigation are two organizations that are trying to elevate the conversation to policymakers and also the funding space. At the Mental Health in Journalism Summit in the past 2 years, we've held sessions specifically for funders so that they understand the importance of this topic and talk with each other about how to prioritize this within their funding mechanisms. I'm going to put the links in the chat in a second, but you all can go to the Self-Investigations YouTube page where there are recordings including this on this topic. So when we're talking about systemic change, it includes all stakeholders, and we're trying to work on that direction.
Yeah, indeed. Thank you, Mar. And of course, this study has been done as part of a EU funded project. So with the results, we're able to kind of present them to the European Commission and show that there's an important need for funding in this area. So it's the start, for sure. It's not the whole solution. But indeed, as you say, there's a need for more of a spotlight on this issue, especially for donors to realize how important it is. I wonder if anyone else has any other questions? Or perhaps our speakers were very, very informative. I don't know if in this case, Emma, if you have a question. Oh, I think Sarah has a question.
I know how to put my hand up. Yeah, no, it sneaks up a question and a comment. Also, thank you, Sanna, for showing what Wiley is doing. I just paid attention in Sanna's also slides when we look at what we are doing or able to do, we never sort of like mention what happens in the societies. Like we know at Wiley there are huge funding cuts that are not don't come from the company but from the government. Also, when we talk to the younger journalists, many of them are really anxious because of the war. Like today, it's 4 years in Ukraine, Gaza, all this situation, and like the overall, trying not to use a swear word, the overall problematics that we see everywhere. So I'm just wondering, how does this sit into this? Because it's not just the working conditions or the workplaces, it's like the world around us. And I think for this, we would just need more opportunities to sort of like talk to each other and support each other, like cross-border kind of things. I don't know what this could be, but this is like what comes to my mind. Thank you.
Thanks, Sala. I think the point about generations is a really important one. I mean, I'm a parent of teenagers, and I feel that kind of the existential angst of the younger generation and my own existential angst are all combined actually as a parent, obviously. I think that's why, while what we were saying, we definitely need funding for more professional support and more therapists. This can't all just be done by peer support, but I think that is precisely why kind of lower level interventions that small things that we can do to support each other are so important, because we can't wait until the money is there for the professional therapy for everybody, but we can start being more supportive to each other and also saying you're not alone. Other people feel like you do, and it's okay to ask for help. I think that's the most powerful thing. And actually, that's something that the younger generation is teaching us, because, they're so much more alert to these issues of mental health and willing and expecting this kind of support from the organizations they work for.
Thank you. Yes, I agree.
Thanks.
And let me just say one sentence. I know we're running out of time, to the beautiful explanation Emma just did, which is this is a problem that is happening to many other professions. And I think that there's a lot we can learn from other professions that are vocation driven, that have budget cuts, that are not like, that are like with intensity and the 24/7 pressure. We're not the only profession. So I would say one call to action here is also to look outside of the media and see what we can learn. And my final message would be around the fact that the workplace can be a place of hope and a place that promotes resilience instead of a place that adds to the chaos and uncertainty that we live, given all the context that you just said, Sala. So I think that in order to have the most productive employees and the best journalists possible, we really need to prioritize this issue. And it shows the context puts even more pressure on how this topic is so urgent. So hope, to me, is a word that we should work on, and a concept and value we should work on and promote in newsrooms today, more important than ever. And it needs to be done proactively. It will not happen if we don't do something about it now.
Thank you very much, Mar, for such a positive message. I saw a hand raised by Angelina. I don't know if you still want to ask your question, and this could be the last question that we take.
Yes, I'm a journalist, and I'm 23. In 3 years, I covered war in Ukraine, and I left my country to cover war in Ukraine. So I wanted to ask a question like, what advice maybe do you have to young journalists who just like enter this field right now? Because among my peers, I see anxiety towards the future. Thank you.
Well, I would just like to add on to Mar's message about hope, because I think, like I said at the beginning, I still think this is a great job. I still think it's despite the pressure that we put on ourselves when we're in the job, it's an important job, which many of us do with passion, and that is necessary for democracy and for our societies. And I would just urge you to, keep doing that important job while looking after yourself, and not doom scrolling every minute that you have. Like, allow yourself to have joy and to have pleasure in life. And it doesn't make you a bad journalist to occasionally switch off from the news. I think that's a message that I wish somebody had said to me earlier in my career, that you can still be a great journalist and do other things in your life, and that's okay too.
Thank you very much, Emma. I think we can wrap up here, even though the questions have been really interesting in themselves. So thank you to everybody who asked questions, who participated and stayed with us in the last hour. I think we've ended on a nice message of hope, of the need for cross collaboration or cross country support, and the need that we don't only put the onus on the individual to take care of themselves, but there's also the structural need for organizations, governments, and culture and societal changes. So it's quite a big task ahead, as Nevena correctly pointed out. But we hope that the recommendations in this report, the work that both of our organizations are doing, can be of help. You've got all the links and contact details in the chat. And if there's any follow-up that you would like, you can always reach out to any of us who have spoken today. Thank you all once again. Thank you to our amazing speakers, and hope you all have a very nice day and a very nice week. Thanks, everybody. Bye.
Thank you. Bye-bye.
Thank you.
Thank you.
Gracias. Bye bye.